Welcome back to News Center right here on KTN News. We thank you so much for staying with us. Now, the World Health Organization is warning that the new Omicron variant of the coronavirus poses a quote-unquote very high global risk because of the possibility that it spreads more easily and might resist vaccines and immunity in people who were infected with previous strains. The World Health Organization warned its 194 member states of the new variant's numerous mutations may confer immune escape potential and possibly transmissibility advantage, and as a result this may result in, the likelihood of potential further spread of the Omicron at the global level is high. It says that the risk to vulnerable populations, especially in countries with low vaccination rates, could be substantial. However, it cautions that there is still considerable uncertainty about the virus, including how easily it spreads, how dangerous it is, and whether it can evade vaccines and immunity, how it responds to diagnostic tests and therapeutics, and
Fauci went on to praise South
symptoms.
African officials.
Sada Hassan is looking at that virus and what it portends, and now joins me here on set. Sada, thank you so much for speaking to us once again. Earlier on, you were talking to us about the concerns, but mainly for Kenyans who have been hearing about this Omicron virus strain of the coronavirus. What exactly is it? I mean, the emergence and where it has been reported so far.
All right, so something about viruses is that every time viruses keep on changing, you know, in order for them to survive, they have to change how they look or how they transmit. Yeah. And this is just one of the new variants of coronavirus. So previously we had Delta, and we also had cases here in our country. We also had Gamma variant, we had Lambda, and about 10 variants that have been recorded so far globally. Yeah. So this Omicron is a new variant which has a high mutation compared to Lambda variant and Gamma variant and maybe all the other variants. So according to WHO, it is about 25 to 32 mutations, which is quite high. And, you know, it poses a challenge to scientists because it is something new. They don't know much about it, and they're trying to understand how it works, how it spreads among people, and also how it works with the vaccines, because this is something we don't know yet because it is new, and a lot of research has to go into it to understand more about it. So countries are currently taking up measures to ensure that they protect their citizens, and some of the measures that have been put in place is like the transport sector, whereby flights have been banned in some countries, especially to South Africa, where where this variant was particularly detected by, you know, the scientists told the World Health Organization about it. So a lot of countries are taking up measures against the South African countries, which globally is being seen as something that is not fair, because you consider that this variant has also been detected in countries like UK, Hong Kong, you know, and putting up measures like this is quite drastic, and you know, we should right now be focusing on ensuring that all of us have vaccines. And this is a clarion call by the World Health Organization, by the Ministry of Health in the African regions, that instead of putting such drastic measures, why don't we vaccinate many Kenyans as possible? You know,
and we will get to the vaccination rates and, you know, the numbers in Kenya. But I'm seeing that, you know, this Omicron variant was reported in Scotland, and we did see that the country, the UK, is speeding up now vaccination for the booster shot. Perhaps do we expect that then this could for some reason accentuate the speeding up of the, you remember the booster the conversation of the booster vaccine in Kenya, even for a country which is yet to achieve the 10 million vaccination. Where does this then bring the conversation of booster shots, not only in Europe and other countries, but also in Kenya?
All right. So there are two ways to look at it. When we talk about booster shots, there is the issue of pharma coming up. You know, right now we have Omicron variant, and the pharma is already coming up and saying we might need booster shots to ensure that you're protected against this virus. So it is, in a way, if you look at it, it may be business, and in a way, if you look at it, it is a way of protecting more people against this variant, because we don't know much about it and we don't know how severe it is, because currently in South Africa, we've seen a rise in infections, which is quite unfortunate right now. So here in the country, the Ministry of Health still emphasizes that we don't need booster shots yet, because, I mean, we've not even vaccinated even 10% of our nation. So this is a conversation that we just have to keep on looking at it and see how it progresses. But so far, talking about booster shots, it is a conversation that many African countries are not ready to have because we've not vaccinated a huge number of our population. And that is why we're calling for more vaccination to be done here in our African setup first.
With the State of the Nation address coming up today, Sada, from a health perspective, from a health journalist, what did you expect, perhaps anticipate from President Uhuru Kenyatta on this? Because of course COVID-19 will feature mainly on his speech on his State of the Nation. Perhaps what you do anticipate the President, I mean going by your research and what you're seeing from other countries, what are some of the things that perhaps he may be able to convince Kenyans to do or even speak about?
So unfortunately, some countries have gone back to lockdowns or, telling their people to wear masks, whereby previously they had stopped putting on masks. So in our case, we've seen the numbers really go down compared to maybe 5 months ago or even last year. Maybe in the last 1 week, we've seen numbers ranging from 11 to 50 something. So with this, we do not expect the president to close down the country. And actually, previously this week, we had the PS, Susan Mochachi, saying that we're not going to lock down the country. So I do not expect the president to lock down the country. That is first and foremost. And then second, I expect the president to talk about the economic recovery of the country. We've seen hospitality sector being affected much, and especially right now that we're going towards the festivity seasons. So as much as we have COVID, then I'm expecting a lot of emphasis on measures that we're supposed to put in place or to, keep on living with them, like wearing of masks, putting hand washing points in every place where we go, and also emphasis on vaccination, because right now the numbers of vaccination have slightly gone down. We're stuck at 6.9%, yet we expect to get to 10 million by December. So this is something that we are looking forward to, and also I'm expecting the president to talk about the Omicron variant, because this is a new variant, and also us as a country, we are, taking all the measures possible, because we are affected in one way or another. People are still coming into our country. We are still going to South African countries. So this is one of the conversations that the president should also include in his address today.
So Sandra, back to the conversation on the COVID-19 and the variant. We did see that when COVID-19 came in, the other infectious diseases, especially those that were caused by hygiene, diarrhea and vomiting, went down because of enhanced and thorough sensitization on Kenyans to maintain hygiene by washing their hands with soap and using hand sanitizer. How is the status of that so far?
So we do not have accurate data so far, but according to the Ministry of Health, the levels of non-communicable diseases have gone down slightly compared to how it was maybe previously. Maybe this is because many people are now washing hands. We've taught our children to learn the basic of hand washing, how to scrub in between your hands when you're washing. Just the basic, really good sanitation and hygiene practices that every Kenyan should know. So there's a lot of emphasis on that right now, and maybe we can say that has attributed to low levels of diseases, non-communicable diseases coming up. Last week, we were speaking to UNICEF and doing a story around sanitation in Homa Bay in Siaya County. So the levels of open defecation have gone down in Siaya County. In fact, some of the villages have been declared open free, a majority of the villages actually. So this is a good practice, I can say, that has come out of COVID-19, but we still need to do more, because Homa Bay is still among the counties with high open defecation rates, and Kenya is still among the countries with high number of open defecation rates. And
so when you look at it nowadays, how is the prevalence of COVID-19? While the statistics you were saying between 11 and 55 in a day, that is quite really low. From the statistics coming in from the Ministry of Health, is it more on the urban centers or in the rural centers, or is it a blend?
I would say it's a blend, but still Nairobi accounts for many of the COVID-19 cases. We can say maybe it's because of our centrality, being a central region, being a key point of destination economic businesses. All of us are coming in and out of Nairobi doing something or another. So this can be a reason why we have many cases coming out from Nairobi, but the numbers have really, really gone down compared to maybe 2 months ago, 3 months ago. So I will say right now we are on a good track, because we're recording a positivity rate of between 0.5% to 0.9%. This is low. You can't compare it to at a time when we were recording 12 point something percent or even 20 something percent. So we are at a good state, and I'm expecting that you know, moving forward, a number of Kenyans should really take up the vaccine because it is a way that the World Health Organization has told us you can be able to protect yourself and your loved ones. Yeah.
Indeed. Thank you very much indeed. I've been speaking to Saada Hassan, our health and science reporter, talking to us about that COVID variant, that is the Omicron variant that has been reported in some parts, other parts of the world, including Europe, and some countries have gone back to their